evening. I am Professor Syed Mosaddek from Bangladesh. I am Professor and Head Department of Pharmacology, Uttara Adhunik Medical College, which is one of the leading private medical college in Bangladesh, situated in the capital city of the Dhaka. I am also the Director on Clinical Trials of the Quest Bangladesh, which is our research group. I am going to disseminate our research findings. Topic is the effects of the ABCB1 gene polymorphism on toxicity of the Taxane-based chemotherapy in Bangladeshi patients who are suffering from the triple-negative breast cancer. Triple-negative breast cancer is highly prevalent in our country. Mortality due to the breast cancer is also high. Triple-negative breast cancer poses the significant challenge due to the aggressive nature and the limited treatment options. There is the chance of developing toxicities with the Taxane-based treatment, and this can differ from person to person due to the genetic variation. Drug response and toxicity are influenced by the genetic polymorphism. We have selected the ABCB1 gene variation, response variation, and the toxicity variation among the breast cancer patients in Bangladesh. Our study objectives was to assess the impact of the ABCB1 gene polymorphism on toxicity of the Taxane-based chemotherapy in Bangladeshi triple-negative breast cancers. We conducted this study on 100 female patients who suffered from the breast cancer. They received the Taxane-based chemotherapy, neoadjuvant therapy. We collected sociodemographic and clinical information during the study procedures. Also, we evaluated the Taxane-induced chemotherapy during the treatment. Genetic polymorphism was detected by the PCR RFLP techniques. Now I'd like to share the results of our study. ABCB1 genetic polymorphism was found to be significantly associated with the chemotherapy-induced anemia, neutropenia, and the GIT disorder. Patients with the mutant homozygotes TT genotype of the ABCB1 gene had a significantly higher risk of developing anemia in comparison to the normal homozygote CC. In addition to that, patients with mutant homozygote TT and the heterozygote CT plus mutant homozygote TT genotypes of the ABCB1 gene was highly significantly risk of developing neutropenia and the GIT disorder in comparison to the normal genotype CC. But this study findings revealed that there is no significant relationship between the leukopenia and the ABCB1 gene variation. So the conclusion of our study findings is that the genetic variation in ABCB1 may influence the toxicity of the Taxane-based chemotherapy in Bangladeshi triple-negative breast cancer patients. Though that due to the fund limitation, we only included the 100 female patients who are suffering from the triple-negative breast cancer. Upon availability of the fund, in collaboration with the other organizations, both national and international level, we were planning to conduct the large-scale study with larger sample size. Thanks everybody for giving me opportunity, and thanks the organizer to giving me opportunity to deliver our study findings, I'd like to share the additional information. This study was the first study in Bangladesh to find out the genetic polymorphism related drug response variation among the patients suffering from the breast cancer. Thanks, everybody.